CEU. I have been a CEU provider since 2018 and have been in this profession for 21 years. I have a master's degree in public health. I enjoy being an educator and giving back the knowledge I've obtained during my career. Now it's time to earn your CEUs by watching this video and taking an exam and survey at the end. You at least need to get 70%, then you will get your certificate and will earn 1 CEU. CFR Part 2 regulations serve to protect patient records created by federally assisted programs for the treatment of substance use disorders. Part 2 has been revised to further facilitate better coordination of care in response to the opioid epidemic while maintaining its confidentiality, protects against unauthorized disclosure and use. What has not changed is under the new Part 2 rule, the revised rule does not alter the basic framework for confidentiality protection of substance use disorder. Patient records created by federally assisted SUD treatment programs. Part 2 continues to prohibit law enforcement use of SUD patient records in criminal prosecutions against patients, absent a court order. Part 2 also continues to restrict the disclosure of SUD treatment records without patient consent, other than as statutorily authorized in the context of a bona fide medical emergency or for the purposes of scientific research, audit, or program evaluation, or based on an appropriate court order. What has changed under the new Part 2 rule? The revised rules modify several major sections of Part 2 as follows. Provision. What changed? Why was this changed? Applicably and redisclosure treatment records created by non-Part 2 provisions based on their own patient encounters are explicitly not covered by Part 2 unless any SUD records previously received from a Part 2 program are incorporated into such records. Segmentation or holding a part of any Part 2 patient record previously received can be used to ensure that new records created by non-Part 2 providers will not become subject to Part 2. To facilitate coordination of care activities by non-Part 2 providers. For the provision of disposition of records when an SUD patient sends an incidental message to the personnel device of an employee of a Part 2 program, the employee will be able to fulfill the Part 2 requirements for sanitization the device by deleting the message. It changed to ensure that the personnel device of the employees will not need to be confiscated or destroyed in order to sanitize in compliance with Part 2. The provision for the consent requirements. An SUD patient may consent to disclosure of the patient's Part 2 treatment records to an entity, example given the Social Security Administration, without naming a specific person as the recipient for the disclosure. This provision was changed to allow patients to apply for benefits and resources more easily. For example, when using an online application that do not identify a specific person as the recipient for a disclosure of Part 2 records. Disclosures permitted with written consent. Disclosures for the purpose of payment and healthcare operations are permitted with written consent in connection with an illustrative list of 18 activities that constitute payment and healthcare operations, now specified under the regulatory provision. In order to resolve lingering confusion under Part 2 about what activities count as payments and healthcare operations, the list of examples has been moved into regulation text from the preamble and expanded to include care coordination and case management activities. Provisions for disclosures to central registries and PDMPs, non-OTP opiate treatment program, and non-central registry treating provisions are now eligible to query for central registry in order to determine whether their patients are already receiving opiate treatment through a member program. OTPs are permitted to enroll in a state prescription drug monitoring program, PDMP, and permitted to report data unto the PDMP when prescribing or dispensing medications on Schedule 2 to 5, consistent with applicable state law. To prevent duplicative enrollments in SUD care, duplicative prescriptions for SUD treatment, and advertised drug events related to SUD treatment. Far as medical emergencies, declared emergencies resulting from natural disasters such as hurricanes that disrupt treatment facilities and services are considered a bona fide medical emergency for the purpose of disclosing SUD records without patient consent under Part 2. To ensure clinically appropriate communications and access to SUD care in the context of declared emergencies resulting from natural disasters. The provisions for research. Our disclosures for research under Part 2 are permitted by HIPAA covered entity or business associate to individuals and organizations who are neither HIPAA covered entities nor subject to common rule. Research on human subjects. To facilitate appropriate disclosure for research by streamlining overlapping requirements under Part 2, the HIPAA privacy rule and the common rule. Audit and evaluation. It clarifies specific situations that fall within the scope of permissionable disclosures for audits and or program evaluation purposes. To resolve current ambiguity under Part 2 about what activities are covered by the audit and evaluation provision. Under undercover agents and the informants, court-ordered placements, and undercover agents or informants within a Part 2 program is extended to a period of 12 months, and courts are authorized to further extend the period of placement through a new court order. To address law enforcement concerns that the current policy is overly restrictive to some ongoing investigations of Part 2 programs. Thank you for watching and for choosing to get your continuing educational units for your addiction profession with Addiction Counselor CEU.